The following is brought to you by Cosmetic Surgery Center.
All right, Dr. Rhys Branman joins us today from the Cosmetic Surgery Center. We're going to talk about Vaser Liposuction.
That's right.
If you say Vaser when you call, they'll know what you're talking about, but
That's
it's
right.
Vaser like laser almost.
Vaser like laser,
Okay.
exactly.
Yeah.
And it's a improved way of doing liposuction.
Okay.
There used to be the old way of doing liposuction where you would just stick a tube in and suction out fat.
Yeah.
And that's a little aggressive, and it would create a lot of swelling, bleeding, and a lot of problems. And they developed this way called Vaser Liposuction, or ultrasound-assisted liposuction, where what we're doing is we're breaking up the fat and allowing the fat to come out easier than what they used to do.
Okay.
And it's really great for a smoother result. You get less swelling and less bruising, and the recovery is the same or better than what you'd have with the older style of liposuction. I really like it because you get a much smoother result. And you're able to get the fat out, and especially in harder places to get the fat out. For example, in people who have had surgery before,
Right.
there's a lot more fibrous tissue. It's much harder to get out. In men tend to be more fibrous than women, and their fat is harder to get out. And especially, we've talked about this before, male gynecomastia, where we're trying to get the chest area, that does tend to be very fibrous, and the Vaser works very well for that.
Yeah, so you're really kind of working on that fat before you ever start drawing it out.
That's
You're breaking it up.
That's right. We're getting it numbed up, we're getting it so it's not going to bleed, and then we're kind of working on it. It's kind of like getting the honey out of a honeycomb. It just comes out a lot more easily.
Okay, there you go.
That's right.
And we all want that. We want the honey.
We all want the honey going.
Honey out. What parts of the body is this most common?
Oh, well, the most common areas are abdomen, waist flank, and back, and we can do those three areas all together and get the circumferential tightening of the entire midsection. And a lot of people like that because they've got a little bit of a gut going on.
Yeah.
And so the other areas we talked about, male gynecomastia. We do all the leg area,
Okay.
except for the very low leg.
Yeah.
So we'll do medial thighs, lateral thighs, anterior thighs, and really reshape the entire circumference of the leg.
That is awesome.
Yeah.
Let's look at a few pictures of before and
Yeah,
after.
and you can see that she had a lot of fullness on the left side, and we've reduced that quite a bit and really given her, really shaped up a lot of those kind of areas that are just bulging out.
Yeah, and that's her back, so that's kind of rolls
And that's her back,
on
and
the
she's
back.
actually fairly new out. And here you have this whole fullness of the abdomen on the left side,
Right.
and now we've totally shaped that in and brought that in very nicely.
Yeah, she is ready for the bikini.
She is ready for the bikini. That's right.
And these are areas, I know you've heard your clients say, look, I'm doing my exercises, I'm trying to eat right, and I just can't get rid of this area.
And you have to realize that liposuction is not a weight loss procedure. What it is a contouring procedure. And so what we're doing is we're contouring those areas, just like you said, that are hard to get rid of.
Right.
And it works the best in those people who have either lost weight or can maintain their weight. And then what we do is we reshape the body so that they have just a better contour to their figure.
Okay, and there's still time to do this in time for swimsuit
There is.
season?
I mean, if you could get in now, you'd be ready for July and August and ready to go.
Yeah, what kind of downtime do you usually see?
I would give it about, initially about a week downtime.
Okay.
And then, give it at least 2 months to really contour in, and you'll see the majority of the results.
Yeah, so kind of take it easy for a little while.
Take it easy for a little while. I mean, you're back to work within a week.
Okay.
But the final contouring, that final swelling, takes a good couple of months to get rid of.
Very good. And you said you can combine some areas.
We can. We can combine legs. I mean, it really is volume dependent. And so we can do the entire abdomen, waist, flank, back. We could even do legs at the same time if it's small areas. But if it's larger areas, then we have to limit it to just certain anatomical parts.
And if the results are what you want, you can come back at another time to do the rest of it, right? To be sure that you look and feel your best. So consultation, is that where you would start off with someone?
Absolutely, always. Call the office, talk to Melinda, set up a consultation, and I think you would really be happy with the results.
The nicest staff ever. I always say that, but they really are. The Cosmetic Surgery Center right there in West Little Rock. Easy to find.
That's right.
Yeah, easy to drive in if you don't live in
Call
Little Rock.
for a consultation, and we'll get you. We'll at least give you the information you're looking
That's
for.
all. That's all it's about.
And that's what it really is about.
Exactly. No commitment at that point.
That's right. We won't tie your hands to it.
Exactly. There's the information. You can go online and look at more before and after pictures as well. This includes men. This is not just for women.
That's right.
And there's there's the phone number if you want to call and set up an appointment with them. Thank you, Dr. Rhys.
Thank you very much. Appreciate you.
We appreciate you too. Okay, back in a moment, we are talking strawberries with Amy from the Cabot